Back at 8:08 and this morning on Today's Family, how young is too young to get plastic surgery? The number of teenagers in the U.S. who've gone under the knife has doubled in the past 8 years. So what is driving teens to have these procedures? Plastic surgery. Some may do it to capture a piece of the glitz or the glamour of celebrity. But what if you are a teenager and surgery could take away the name-calling, the embarrassment, or the physical pain? Should parents let children have it? And should children have it? People magazine investigated why many teens are going under the knife.
Well, we decided to do a story on teen plastic surgery because we noticed that there were a lot of teens who were looking for a way to improve their lives because they've been bullied or abused or really just been attacked because of the way that they looked.
Unlike adults who may use plastic surgery to turn back the clock, these teens use plastic surgery to fit in. She had rhinoplasty at 15.
It's no different than kids getting braces for crooked teeth.
Dr. Sam Rizk is Jen's surgeon.
I think that having that stigma of a large nose taken care of allows the teenager to focus on other important aspects of their growth and their school.
But psychiatrists say the first step for parents and children alike is to ask why.
It's not always that body issue that is the issue. There's other stuff. These children are part of families, they're part of communities, and there may be other things that are not working that are driving that need for the surgery.
Plastic surgeons with teen patients recommend a series of at least 4 sessions with a therapist before approving surgery.
I always ask them for their motivation. It's very important to basically understand their psychology.
And another word of caution.
Mom and Dad, please be sure your adolescent or your teen is aware that this is not a coping skill, that every time we feel uncomfortable about ourselves, then we go out and we get surgery, because that's how we begin a huge line of problems.
And Hannah Olson, John Escalante, and Jen Selter are here this morning, along with Jen's mom, Jill Weinstein, and also NBC's chief medical editor, Dr. Nancy Steineman. Good morning to all of you this morning. So now that you've had these procedures, how has life changed? Has the kind of harassment, the kind of worry about what other people think, has that diminished, Hannah?
Yeah, absolutely. And the physical handicap that having large, breasts places on, a young person who's athletic, and I was a dancer, and that kind of thing has definitely gone away. The harassment was mostly sexual for my problem, but that my main reason was just health reasons and pain and just the inability to be active.
Do you think that if you had not been harassed or made fun of, that you would have, or worried about being made fun of, do you think that you would have had the surgery?
Either way, I think I would have still gotten it, because emotionally and inside myself, I knew people were still looking at me. I didn't like that kind of stuff. So either way, I think I would still got it, no matter what.
Jen, you, in the piece, we saw that you had been actually called names, and it was very hurtful to you. I mean, you've inherited something from your family, and you've had to change it because of harassment. So how do you feel about that?
Well, all my life I knew my nose was my negative aspect to my face, and all the bullying and the Facebook negative comments just made me more insecure and self-conscious. So it came to the point where I had to get my surgery done, and I'm so much happier.
Did you think about, my gosh, because this kind of surgery entails all kinds of risks. I mean, people actually have died from plastic surgery. At what point is it worth it, and what point isn't it?
Well, when your daughter comes home from school every day and she has tears because she was bullied because of her nose and they made fun of her, I mean, at some point we have to take a step and decide, what are we going to do about this? And what I did was I took, action, and I researched it through the neighborhood, and I found out that Dr. Rizk was a man that was going to be able to help her. And he did wonders for my daughter. I mean, she wakes up every morning and with a smile, and she's happy.
Well, and that's terrific for Jen and for all three of you, because all three of you are examples of where you're happy with the results. I mean, Dr. Nancy Steineman, I think a lot of people watching might think, okay, but listen, we're living in this culture where people are sculpting because they want higher cheekbones, where they want, and especially with all the...
Therein lies the difference. You're looking at 3 very appropriate cases for wanting to change things. I mean, Hannah was almost a physical disability of breasts that are too large. Ears can be pinned back in children much younger than John shows, and to have a mother-daughter exchange about this tells you it's not mom's idea to have surgery, it's a daughter saying, Mom, will you help guide me? And those are the things that doctors are looking for. All three of these procedures now, very mainstream. Remember, we're not looking at 10 and 11-year-olds. We're looking at young adults who are part of the decision-making process.
Yeah, but if a young adult came to me and said that I want bigger breasts, or came to me and said I want to have less on my waist, or I want to have,
you know what?
Isn't that also part of this doubling of this number?
Well, I think we all have a gray line, and for me that crosses a line, because you're saying, well, I want to have Britney Spears' face, I want cheek implants, I want my butt lifted. That's so purely cosmetic. Here you're looking at psychosocial, psychiatric, physical stuff that's all entwined, and I think very appropriate use of surgery.
All right. Well, on that note, we're going to have to leave it. Doctor, thank you. And thank you to Hannah, and also to John, and to Jen and Jill. Thank you so much, all of you, this morning.
Thank you.